Question for Derek about mental health stigma. How should we talk about mental health in the locker room?
Ben, that's a great question. I think first and foremost, like just talking about it, period, is a really good thing. I think we want to normalize this idea that it's okay to not be okay sometimes and to ask for help. And as Dr. Cook had mentioned, sometimes by identifying anxiety or depression or a family issue or a performance issue, the feeling might be, oh, I'm weak or I have this problem. And, but we look at the mental health numbers from the NCAA study during the pandemic, and it's crazy how much how much these numbers have increased, right? I don't want to say crazy. They've elevated these numbers have been elevated quite a bit over the pandemic, and mental health is a very real thing. So I think first and foremost, talking about it in the locker room would be normalizing mental health symptoms. Everyone goes through stuff, right? Sometimes different stressors can exacerbate maybe a condition that somebody has already, or can create anxiety given the circumstance or the situation. And maybe if there's a lot of things happening at once, it may create a lot of worry or overthinking there. I think what's also important too is, student athletes spend so much time in the weight room and thinking about the right nutrition and things like that. We take care of our bodies physically, but we also need to be taking care of our minds in the same way, right? So paying attention when we feel off balance. I think that's the best way to think about it. At least for me, that's one way that I think about it is, okay, if a student athlete is feeling off in some way, or they're feeling really good and they don't usually feel that way, or they're feeling like super low, right? Wanting to ask questions about that. I think what's also really helpful is kind of like a top down approach when our head coaches and our assistant coaches are modeling this mentality and kind of yielding similar behavior, creating an environment of honesty where we can talk about mental health symptoms that may come up, or different stress management tools that have helped, and normalizing the fact that maybe even themselves, either when they were athletes or other folks that they've worked with in the past, that it's normal, it's common, it happens. And let's kind of look at this from a prevention model rather than intervention. The idea that we can kind of address some of these maybe warning signs earlier on, get the student athlete connected to the support services that they need, and then they can just, have a kick butt season.